the cerebral spinal fluid via lumbar puncture that measures for beta amyloid and tau, and based on those, it can tell you if you have Alzheimer's disease with a 96% accuracy. Just another alternative to the brain imaging. Chiropractic care has been shown to increase cerebral spinal fluid flow by removing structural obstructions at the craniocervical junction, the atlas, the top bone, and the angle of the occiput, which is our skull here. And if you have signs of subluxation and decreased cerebral spinal fluid flow, it could be things like headaches or issues with sleep or sinus problems, numbness in the hands, acid reflux, or the most dangerous symptom of subluxation is the no symptom, meaning that for a lot of people, they can have misalignments of their vertebrae and not feel any symptoms. Sometimes for decades, the problem is there affecting the functioning in their body, but they're not getting the warning signs of the pain. And so I always urge people, don't wait until you have the pain to do something about it, because taking care of it before you feel it can be so important and much easier to fix. This is, hopefully you guys can see this well. It's moving.
The ventricular action. Notice the disc herniations, and notice the cord descending down here over C5, C6. Notice the bulges here, and the fluid trying to descend down. This is a stenosis occurring here.
It's not the easiest thing to see.
And you'll notice that it's much
This is
less
part of a
bright
study
white.
where they were looking at the
pulse.
cerebral
When you look at the
spinal
pulse in a
fluid
second,
flowing
you'll
in
see.
the canals
And then
pre
it'll
and
be much
post
brighter
adjustments.
And much more descending down. And
In
you
a
can
minute,
see here the
I'll
focusing
show you
of the
right after the
ventricles.
adjustment
It's almost
where
like
he
a
sees increased
milky
CSF.
type effect.
So this is like a
And you
CT scan.
notice the change in signal. Now, one of the most amazing things about our research
Yeah, like an active.
was that even prior to getting to the stage of the flow studies, we were able to show changes of signal intensity. And the increased white that you see is a change in signal intensity. Remember, nothing's changed here except the patient being adjusted. Therefore, changing the signal intensity interpreted by the MRI magnet.
Oh, thank you.
This is the same patient on the post-adjustment. Look how much brighter it gets. It bounds at you. One, surges. Two, if you look down the cord, it's surging down the cord. Her CSF was going barely. Obviously, she was alive, but now she's alive. You see here cerebral cortex activity where before it was stagnant. And when you have this image, isn't this the image we get and feel after we get a good adjustment? You notice those changes. We feel almost as if this picture is telling us how we feel after we get adjusted. Notice the pulsation. The size of this foramen magnum has opened up tremendously. The disc herniations. And you can see the pulsation descending down here to C6 and C5 area where it wasn't before.
But there's also MRI studies, pre and post MRI scans of the brain, pre and post adjustments. You see areas improve in functioning and blood flow. There's so many benefits that we don't always get a chance to talk about. I think that is